Collectively, we call them platelet aggregation inhibitors, or simply antiplatelet drugs. One of the most widely known drugs that belongs to this class is aspirin. In order to understand how aspirin works, let's take a closer look at the inside of a platelet. So when platelet becomes activated, arachidonic acid is released from the membrane phospholipids. Then it gets converted to prostaglandin H2 by cyclooxygenase 1 enzyme, also known as COX-1. Finally, prostaglandin H2 is further metabolized to thromboxane A2, which is released from the platelet to stimulate activation of new platelets as well as promote their aggregation. So what aspirin does is it irreversibly inactivates COX-1 enzyme, thus effectively disrupting clot formation. Next, we have platelet aggregation inhibitors that work by blocking the action of ADP receptor, specifically P2Y12 subtype. Drugs that belong to this group include clopidogrel, ticagrelor, ticlopidine, and prasugrel. As I mentioned before, activated platelets release chemical mediators. One of them is ADP, which binds to P2Y12 receptor, leading to activation of the glycoprotein 2B3A receptors, which are required for fibrin-mediated platelet cross-linking. So by blocking P2Y12 ADP receptors, these drugs effectively inhibit platelet aggregation and thus clot formation. Next, we have glycoprotein 2B3A receptor blockers, namely abciximab, eptifibatide, and tirofiban. These agents simply inhibit platelet aggregation by binding to the glycoprotein 2B3A receptors on platelets, thus preventing fibrinogen from binding to platelets and making them unable to cross-link. Unlike the other drugs that we discussed so far, glycoprotein 2B3A inhibitors are administered only intravenously. Now, the last group of antiplatelets drugs that I wanted to briefly discuss are phosphodiesterase inhibitors, namely dipyridamole and cilostazol. These two agents inhibit enzyme called phosphodiesterase that is responsible for breaking down cyclic AMP to AMP. So by blocking this enzyme, dipyridamole and cilostazol increase intracellular levels of cyclic AMP, which in turn leads to decrease in intracellular calcium and ultimately inhibition of platelet activation. Furthermore, these agents inhibit phosphodiesterase in the vascular wall as well as uptake of adenosine, which promotes vasodilation. For that reason, cilostazol in particular is often used to treat symptoms of peripheral artery disease, such as narrowing of vessels that supply blood to legs. When it comes to side effects, bleeding is a major risk associated with all antiplatelet drugs. Additionally, dipyridamole and cilostazol, due to their vasodilating properties, can produce headaches. Now let's go back to